Welcome to a new edition of the Famous Interviews with Joe Dimino. On this episode, we talk with Ohio-based physician and author Robert Barkett. He always knew he wanted to be in medicine because of his hero, his father. In his book, Simple Medicine, he discusses the most common medical conditions, complaints, screening, medication, and medical testing in layman's terms. It is an easy-to-understand guide helping patients take control of their own health and challenge their doctors to do the right thing. We get into his life, COVID, the future, and so much more. Enjoy the interview.
Good afternoon, Joe.
Hey, Robert, how are you?
Oh, I'm doing well, thank you.
Good. Hey, thanks for taking a minute out today. I appreciate it.
Getting ready for Friday. It's a beautiful day out here, and I'm out of work, so that's good.
Yeah, you got all the ingredients. Where are you located exactly?
I am in Mansfield, Ohio, which is right in the central part of the state, almost in between Cleveland and Columbus.
Okay. All right. So who do you root for? Who do you guys go for?
I am a total Browns, Indians, Cavs, and a Buckeye through and through.
So I was talking to somebody from Cleveland, and we were talking about the Browns, and the fix the Browns are in is what I remember the Chiefs being in for a long time. Just this karmic wheel of doom that you can't get out. It's like you're stuck in perpetual purgatory. And it wasn't until St. Patrick Mahomes came to town that we washed away all of the sins and blood of our past. But it was a long time.
Oh, ever since we came back in '99, it's just been a shit show. It's unbelievable.
You guys almost kicked our ass last year on opening day, though. Baker and that team was firing on every cylinder. Yeah,
we had that punter mishandle a snap and then like a 76-yard bomb, and we're like, same old Browns.
Yep. Well, I'm pulling for you guys, and I saw something on, MLB during the pandemic, and they were talking about how close Cleveland was to winning that one World Series where they pulled the champagne in the room, and I can't remember who they were playing, but it's like, I don't understand why Cleveland can't get a little bit of that champagne. It befuddles me.
Well, that was Hargrove's fault. We had I think that was the Marlins, and they were all free agents, and we had the game. We're up one, and this Mike Jackson just hit. I mean, he got the winning batter, and he really should have pitched the ninth inning, but he always went with this Jose Mesa, which was, it was a roller coaster ride with him all the time, but he went with him, and he blew the lead, and we blew it again.
Man, it's crazy. Well, so let me ask you this before we get into, simple medicine. I want to know, how did you survive the pandemic and COVID now that we're coming out of it? How did that affect you, and how have you changed the way you are that, we're kind of on the back end of it?
Well, during COVID, I'm in private practice, and so I didn't have to follow a bunch of, rules that hospitals were giving out. So I pretty much kept my doors open, and wear a mask and do the safe things, and we screened everyone. But people, for about 6 weeks, were just scared, and, I probably saw half the patients I usually saw. And then we decided to do telehealth. But after 14, 15 telehealth, I figured my office was the safest place to be, so I just didn't give that an option anymore. I just did not feel that was good internal medicine. And then really, after about 6 weeks, I kind of went right back to my normal.
Now that you look back on this, as someone that deals with medicine, how did we deal with this realistically in a very stark, real way? How did the United States deal with this?
Well, it was, and it's probably still a political issue, but it's a medical issue. And if you look at the statistics to this day, 97% of hospitalizations and 99% of deaths were due to the unvaccinated. You just get vaccinated. Is it, these people say they don't know what's in the vaccine. Well, did we know what was in the mumps or polio or rubella, measles, all that stuff? No, we didn't know. We just took it. And you got to hopefully rely on people smarter than we are, that, there's few complications and that it attacks the, appropriate strain of the virus, and then it mutates, and then you're hoping that it can control all that. And just like this new BA, whatever it is, 25 or whatever, this basically just a bad cold that I've seen. I'm a nursing home director. We have people in there with poor protoplasm, and 8 or 9 people who should probably die did not die, and it was just like a upper respiratory infection. And, but they'd all been vaccinated. And they got over it.
So talk to me a little bit about your life and how medicine became the path. Was that always a dream for you growing up, that medicine was the way you were going to live your life?
Yeah, my father was an internal medicine physician here in Mansfield, Ohio, and it's when our hospital had an emergency room in 67, starting in 67, and when he practiced here. But until like the mid-70s, my father and a few other general practitioners or internal medicines, they had to go see their patients in the emergency room. And then their hospital practice was big, so like every Saturday and Sunday, I have 3 sisters. I think I got kicked out for harassing my sisters, and I would make rounds with my dad. So I knew all the nurses, I knew all the doctors. Got to know patients at that young age, and Dad still did house calls at that time, so I went to people's houses, and there weren't a lot of subspecialists, so he was like the cardiologist, the infectious disease, the rheumatologist. He was all in one and all encompassing, and I just loved that. I loved taking care of the entire, spectrum of diseases. And then also getting to know, all the people involved in medicine.
So what was your path? So how quick did all of this happen and come to fruition for like medical school and all of that?
Yeah, well, happen? I did 4 years at Purdue University, and then I was accepted to Thomas Jefferson University in Philadelphia. And then I did my residency right after that. So Purdue was 82 to 86, 86 to 90 was Jefferson, and from 90 to 93 was Riverside Methodist Hospital in Columbus, Ohio. And then in 93, I actually moved back to Mansfield, which is now away, and practiced medicine with my father until his retirement in 2006. And then from 2006 to current, I am just a solo practitioner with 2 nurses and a front desk girl.
For all of the things that us lay people think we know about medicine, what's the most common misperception? I know in your book you kind of simplify it. There's a lot going on in your book, but what's the most common misconception that a regular person has about the medical field?
I think in this day and age, it's the communication between physician to physician. I think when people go to the emergency room, go and then are hospitalized, and now that the primary care physician like myself is mostly out of the loop, we're all kind of either community doctors or we're hospitalists, and there is a lack of communication when once they go to the hospital, I really don't know what's going on. And then when they come out of the hospital, at least the insurances now make them come in between 7 and 14 days to decrease the risk of a readmission. And then by then, I usually have at least some documents of what happened in there. So I think the lack of continuity of care is a big misconception these days.
So how did Simple Medicine come about? What was the journey to the beginning, the thought of this book, to actually making it what it is?
I think the first part, one of the big reasons was that I am also a hospice director. I'm not the greatest physician in the world, but I do follow the rules and try to do standard of care. And being a hospice physician where I see patients from other physicians, I'm a nursing home director, so I see what medicines are on, plus the new patients that come to my office, is that patients were just lacking in the simplicity of standard of care, meaning not if they have a disease condition, say diabetes, they weren't getting the appropriate tests. They were not on the standard of care of medications, or hypertension. They were not up to date with their vaccines. They were not up to date with colon cancer, prostate, breast, or cervical cancer. And some were on redundant medications. And through the years, I'd lament to some of my specialist friends, like, my God, what I do is not brain surgery. What's going on with these doctors? And then the other doctors, of course, that I'm communicating with, which we still do by phone, talk about this younger generation. And I can't tell you the number of times that people think I get something because they click a button, but I'm not on the hospital system. I'm not on Epic. I'm on Allscripts, and they just think that. And so you never receive information, and some of it's very important. And I call and tell them and get on their case. And then, technology messes up again because there may not be a comma or a comma after my name, and I'm not receiving the appropriate documents. And by golly, there is no phone call from the younger physicians anymore, and it's only the people, the veterans who did not grow up with all this technology. And from there, it was COVID. I had time. I had wanted to do it for several years, and then COVID hit, and I actually had time, and I just started writing.
I hear that from a lot of artists, a lot of people. This really did afford people time to do things that they had been kind of thinking about. I'm curious, who were some of your heroes or role models growing up?
Well, absolutely my father, being in internal medicine, and everyone telling me how they saved him from a heart attack, or he diagnosed, MS, or he diagnosed a cancer, and how grateful they were. And I think before the internet and back in the 60s, 70s, 80s, I think physicians were a little more revered than they are now. Everyone now thinks they're their own physician, and they come in and they tell you the diagnosis and the medications they have versus the symptoms they're having. Plus, there was other physicians in our Mansfield area that I really revered, old surgeons, and I really like this Dr. Jackson, who's an old-time surgeon. I remember when I first came to town, and I really respect him. His dad used him all the time as a surgeon. He operated on my grandfather who had colon cancer, but I thought someone had an acute appendicitis, and so I call him up, and Dr. Jackson, I think this, maybe, and even myself back in the early 90s, maybe we can get an ultrasound and some blood work, and he goes, Robbie, what do your hands tell you? What do your hands tell you? I go, what my hands tell me he's got appendicitis. He goes, then he has appendicitis. Send him right over. So again, old school, and even back then. And so it was usually mostly my father and the local physicians around the area.
What patient or what moment in your practicing life do you remember? One of the best moments that you've had of helping or saving or being a part of something big. Is there a moment that comes to you that you recall like that?
I don't think there is a single moment like that, but there are many moments like that continue to this day where I do have some, but where a friend of mine, a dentist, the last one, he just knew this patient was bad, and he's been to other physicians, and they just weren't getting anywhere. And this has happened several times. And then I do my due diligence and, find the disease, but, so you get that kind of high, but then sometimes these diseases are too late and it's already fatal. So then you come down. But I find myself even in daily practice, sometimes you think you're doing the mundane every day. Are you really helping anyone? But then all of a sudden you come through and they've been to the emergency room, they've been somewhere else, and you pick up like an atypical chest pain, and like the one lady today, and we finally sent her to cath, and she's going to require open heart surgery, but she's going to live, and finding a cancer or, those are big moments when you're like, okay, I am helping people. But a lot of my moments as a primary care physician, it's preventive medicine. So it's hard to prove a truth. I'm making sure, you make, I think, little things like sometimes you got to strong arm a patient to get that colonoscopy, and then they have a tubular adenoma, which if they would have waited any longer, would have turned to cancer. So, you're trying to prevent, the heart attacks, the strokes, the shingles from a shingles vaccine or whatever. So, it's hard, you just hope you're doing your job and hoping not to see a bad result. But you don't get, when you don't know bad results happen, you just kind of hope you're doing your job and you're saving people's lives without them knowing it.
So if you could meet anybody alive on the planet today, who would it be?
Oh, geez. Now you're talking about my sports history. I'd probably say Larry Bird. I played a little basketball in my day, and oh my God, he was my hero. Even though, he didn't go to Purdue or from Ohio, but I just like the greats. I like people and respect people who may not have all the talent and like a Larry Bird in the world, and they just have worked themselves both physically and mentally to be the very best person they could be. You're not going to go to a local park, usually watch him run around and pick him first, but what he did behind the scenes and the amount of training and I think the work ethic and the competitive nature of people like that I am drawn to.
So everyone has a perception of you, your family, your friends, your patients, your readers of your book, but you're the one that's living your life. You have a perception of you. Who do you think you are?
I think I have an old, I did play 2 sports in college at Purdue. I was on the golf team for 4 years. I actually played a year with Gene Cady. I sat the bench, but, as a 6 foot, guard with, about 6 foot, 170 pounds. So I always have had a very competitive nature, a failure to lose type. And I think I'm very open, probably a little arrogant. Sometimes it's my way or the highway. And my patients know that I am always looking for the best, but, may not always candy coat it. It's almost like a parent-child relationship, Sometimes I'm just honest to a fault, and sometimes if they're not getting it, it's almost like the old-time days, maybe they're getting a little spanking, but I do think they know that I have their best interest, because if they lose, I lose, and that's unacceptable.
So if anybody wants to pick up Simple Medicine, learn anything more about you and what you're doing, where can they go on the web?
Well, it is found at, Barnes & Noble. It's on Amazon. It's on BAM, PAL, Indigo, Indie, and like any online bookstore, it should be there. It's on my website at simplemedicinebook.com. And I think a simple search, they have, between all those, they have multiple ways to get hold of this book.
Beautiful. Robert, thank you for taking a minute out. Good luck with everything.
Well, thanks, Joe. You're great. I appreciate it.
Thanks for listening and tuning in to another famous interview with Joe Dimino, where we cover the world of art, literature, medicine, and music around the world. If you want to hear more interviews, visit the Famous Interviews with Joe Dimino channel on YouTube. Thanks again for listening, and until next time.